Can you see my screen?
Yes.
Okay. Okay. Do you want me to reread the
No,
question again?
I have
Okay.
listened the question.
Okay.
Okay. Postoperative pain control. Postoperative pain control is a vital component carrying for surgical. Postoperative pain control is a vital component of caring for surgical patient. Inadequately treated pain can lead to hypertension and patient dissatisfaction as well as delayed recovery caused by decreased ambulation and increased hospital length of stay. This can be exceptionally challenging in patients taking opioids prior to surgery as they often have an increased tolerance to opioid, require larger dose than the opioid naive patient. The classic approach to perioperative pain control include multimodal technique including acetaminophen, local anesthetic, non-steroidal anti-inflammatory drugs, and oral or IV opioids. Patient control analgesia is a method of providing pain control frequently used in the opioid-tolerant population or for those with significant postoperative pain. It involves programming a pump. It involves programming a pump to deliver a small bolus of dose of parenteral opioid in response to the patient pressing a button with a lockout interval and maximum dose to prevent overdose. These allows the mm, patient to control the frequency of analgesic medication rather than be reliant on the nurse for pain medication distribution and improves patient satisfaction. Additionally, the practitioner to calculate a patient. It allows the practitioner to calculate patient to control the frequency of analgesic medication rather than be reliant on the nurse for pain medication distribution and improves patient satisfaction. Additionally, it allows the practitioner to calculate a total opioid requirement that may be utilized to transition the patient to an effective oral regimen. This patient has hypertension likely related to his ongoing significant pain in the setting of previous opioid use. Given that his blood pressure improves after pain medication administration, therefore, the most appropriate pharmacotherapy to improve hypertension should be aimed at treating his pain. Okay.
Okay. Next. 37 primigravida woman at 16-week gestation comes to physician to discuss the results of amniocentesis. She has an IQ of 70. She's employed as a housekeeping assistant. Um, in a hotel and has been married to a coworker for 6 months. She has no family history of serious illness. Karyotype analysis of the features shows Down syndrome. Her pregnancy has otherwise been uncomplicated. She's informed of the abnormalities associated with the fetal genotype and still wants to continue the pregnancy. Which of the following is the most appropriate step in management?
Okay. to meet the criteria to meet the criteria for decisional capacity, patient must express consistent choice and demonstrate an understanding of the risks and benefit of the choice. Demonstrate an appreciation of the significance of the choice for their personal circumstances and illustrate an ability to reason, though through the options. Capacity assessment should be based Capacity assessment should be based on individual patient and particular medical decision being made. Certain population have an increased risk for limitations of capacity, such as patients with dementia or psychiatric disorder. IQ was previously used as the differential criterion for intellectual disability, but has been replaced by DSM-5 by a scale based on the degree of impairment in a variety of the adaptive scale: practical, social, conceptual. This patient has a low IQ but functions independently and does not meet the criteria for intellectual disability. Even among patients with intellectual disability, capacity cannot be assumed to be globally lacking, but may be assessed on case-by-case basis. This patient should be scheduled ongoing prenatal care in accordance with expressed preference to continue her pregnancy. Okay, I don't
So now,
understand.
oh, what what you
This
don't understand?
this baby is dreadful, like karyotype analysis trisomy 21. So
Mm-hmm.
like Down syndrome baby. So
Mm-hmm.
it would be a very hassle. Like it would be lifetime pain if they continue the pregnancy.
Mm-hmm.
So that's why schedule the patient for ongoing prenatal care. Like um, in this, she can abort the baby, isn't it?
Mm-hmm. Mm-hmm.
So that thing we are looking for.
No, but she says she wants to keep it.
Yes, she wants to keep it because maybe she has not have any baby. That may be
Okay.
the reason.
Mm-hmm.
Okay,
So since she wants to keep it, we're keeping it. She's not mentally unstable, so she can decide she wants to keep it. But since the baby is already coming with Down syndrome, then we're going to schedule more prenatal care because to follow up more because the baby is coming already with Down syndrome.
okay.
Mm. Okay, 29-year-old male U.S. Navy veteran comes to the local veteran affairs clinic because of 2-week history of purulent drainage from a small opening at the site of amputation of his left arm. For the past 10 days, he has had increasing pain, tenderness, and redness at the wound site. Okay, 13 months ago, the patient sustained a traumatic amputation of the left arm below the elbow when an improvised explosive device detonated while he was in the Middle East. Management at that time consisted of aggressive surgical debridement of the residual limb, which has healed slowly. A small part of the wound appeared to heal incompletely. The patient appears well, vital signs normal. Exam of the left upper extremity shows like a 3 millimeter opening in the scar with surrounding erythema. The site is draining portal material. The remainder of the exam is fine. Which of the following study most likely to confirm the diagnosis?
So this patient likely has chronic osteomyelitis with adjacent soft tissue infection and a draining sinus tract in the skin. The bone was likely seated at the time of the limb injury and treatment, especially given the evidence that part of the wound experienced poor healing. As indolent infection. Chronic osteomyelitis can present as an indolent infection with gradually increasing pain at the affected site, low-grade fever, chills, and unexpected weight loss. X-ray show light ignition and cortical destruction, and lab studies generally show increased serum inflammatory marker C-reactive protein, a bone biopsy of the wound site needed to confirm the diagnosis with the additional benefit of the identifying causal organism and testing for antibiotic susceptibilities. Okay,
Can you read B and C,
yes.
please?
Complete blood count with differential should be checked and may provide evidence of infection with leukocytosis and left shift on the differential. However, it will not confirm the presence of osteomyelitis.
C.
ESR and serum CRP should be checked as these inflammatory markers are expected to be increased in the setting of the infection. They are useful in monitoring the progression of the treatment, in making management decision as they would decrease with successful therapy.
Okay. Okay, so how do we know here is osteomyelitis? Because it's constant pain,
Yes,
pain and redness in the
pain,
organ
pain,
site,
and there is an ulcer.
and there's a nerve, so that's draining.
On,
Okay.
yes,
Okay.
draining ulcer goes for osteomyelitis.
Mm,
Draining, slowly healing ulcer.
okay. A 2-year-old girl brought to the physician because of a 2-week history of difficulty walking and intermittent crossing of the eyes. She also has had 3 to 4 episodes of watery diarrhea during this time. She has no fever, vomiting. She has no history of serious illness, no medication. She's alert, but irritable and tearful. She clings to her mom during the exam. She 50 percentile for length, 25 percentile for weight, 50 percentile for head circumference. Pulse is yes high, normal. Respiration normal, BP normal. Abdomen is soft, non-tender. A smooth, firm mass is palpable over the right upper quadrant. Neurologic exam shows rapid, chaotic, multidirectional saccades of the eye. There are jerking motions of the extremity which are exacerbated by intentional movement. There is truncal ataxia, and the patient is unable to sit or walk without assistance. Which of the following is the cause of the patient's symptoms?
So in here, what are the key findings?
The obsoclonus myoclone, the eye thingy, and the jerking
Saccade,
movement.
saccadic eye movement.
Uh-huh.
This saccadic eye movement is opsoclonus myoclonus thing.
Uh-huh.
Okay. Opsoclonus myoclonus syndrome. Opsoclonus myoclonus syndrome typically characterized by opsoclonus myoclonus syndrome typically characterized by typically presents in children between age 1 to 3 with acute onset of truncal ataxia. So age 1 to 3 acute onset of truncal ataxia, myoclonus and opsoclonus, a form of saccadic a form of saccadic intrusion. Ocular saccades are rapid, conjugate, basilar, ballistic ocular movements that occur in order to rapidly and precisely change the point of the gaze fixation. Saccades are normal ocular movement that may be voluntarily initiated. Although saccadic abnormalities occur in various pathologic conditions, obstructionis is characterized by rapid, arrhythmic, multivectorial ocular saccades that occur without intersaccadic interval. These features distinguish this entity from nystagmus and other saccadic disorder. Patients also typically display irritability, developmental regression, behavioral or sleep disturbance. The underlying cause of obscureness myoclonus syndrome is unclear but is often occur as a paraneoplastic phenomenon in association with neuroblastoma. Neuroblastoma is a neoplasm of the neuroendocrine cells of the sympathetic nervous system and is associated with over-amplification of the MYC oncogene. It may arise from any sympathetic nervous system. In the most common tumor of the adrenal gland that occur in children, adrenal involvement classically presents with abdominal pain, distension, weight loss, and failure to thrive. Physical examination may disclose firm nodular mass that crosses the midline and diastolic hypertension. Diagnosis is suggested by the presence of increased catecholamine metabolites in the serum and urine. Treatment and prognosis are dependent on the stage of the tumor at the diagnosis and the presence of MYC amplification.
Can you read B and C?
Medulloblastoma is a common malignant brain tumor, often presenting in patients aged 5 to 9 years with signs of increased intracranial pressure, headache, nausea, and vomiting, gait ataxia, or incoordination. It is not common cause of obstructive myoclonus syndrome.
C. Okay.
On Wilms tumor or nephroblastoma is a common pediatric renal malignancy and is characterized by large, often palpable unilateral flank mass. It is associated with Beckwith-Wiedemann syndrome.
So neuroblastoma is the one that closes the midline, and um, neuroblastoma doesn't close the midline. Wait, no,
Sorry,
never mind. Okay, neuroblastoma crosses the midline, and nephroblastoma does not cross the midline. Okay. Okay.
nephroblastoma does not cause the midline. Like
And
what are the feature where it is written? Like if on physical examination, this you are talking about. There
yeah, because
is
usually they have those questions where um you have to differentiate between nephroblastoma and
a
neuroblastoma
neuroblastoma. Okay,
based on like if the tumor crosses the midline or doesn't cross the midline. Like I don't know, they usually have some of those questions.
okay.
Okay. Okay. 3 days after admission to the hospital for acute bacterial endocarditis, 62-year-old man has shortness of breath. Um, that began 5 minutes ago while walking for the first time since admission. On admission, he had 10-day history of fever. Examination shows splinter hemorrhage and normal heart sounds without murmurs. His current pulse is 110, respirations are high, BP is low. Crackers are heard over both lungs. S1, S2 are soft, and there is S3. New grade 2 out of 6 early diastolic murmur is heard at the apex and the left sternal border, and a grade 4 out of 6 systolic ejection murmur is heard best in the carotids and at the left sternal border. Which of the following is the most appropriate next step? There's too much going on.
What is the diagnosis? Early diastolic murmur at the apex.
That's like
Early
mitral.
diast. Sorry.
It's like mitral something because it's at the apex. Mitral.
And then the grade 4 by 6 murmur is heard in the carotids at the left sternal border. And he has infective endocarditis.
Mm-hmm.
Okay. Echocardiography. The development the development of new murmur the development of new murmur in the setting of infective endocarditis is highly concerning for valve damage. The development of new murmur in the setting of acute infective endocarditis is concerning for valve damage. This patient should be evaluated for echocardiography promptly. Complication from infective endocarditis may occur. Two main mechanisms: septic embolization with seeding of distal side and direct injury of the cardiac tissue. Cardiac complication include heart failure caused by valvular insufficiency, perivalvular abscess, pericarditis, tamponade, intracardiac fistula formation, valvular insufficiency as a result of direct inflammatory damage. The most common cardiac complication associated with infective endocarditis may require surgical intervention if severe.
Can you read B and D? B, D.
Ventilation perfusion lungs can are useful in evaluating pulmonary embolism in patients who cannot tolerate CT angiogram, usually because renal disease preventing the use of the contrast pregnancy, contrast allergy. Septic embolization to the lungs often occurs in infective endocarditis. Intravenous furosemide therapy, intravenous
No,
furosemide,
D,
sorry,
D.
okay. IV heparin therapy is indicated for acute thromboembolic disease, which is a complication of infective endocarditis. These patients' physical examination findings are most suggestive of cardiac valve dysfunction. Okay.
Okay. Next. A study is proposed to investigate the effectiveness of a third generation cephalosporin for treatment of strep pharyngitis. The study will include children between ages 5-10. They will randomly assign to receive treatment with cephalosporin, penicillin, or placebo. Informed consent will be obtained from one parent. The principal investigator offers a $50 finder fee to any medical resident who identifies a possible study participant. Which of the following features of this study is of greatest potential concern?
The use of placebo. Use of placebo allows for concealment of the administration of the experiment drug from these subjects from the clinician, helps demonstrate the efficacy of the experimental drug by accounting for beneficial effects that the subjects may experience secondary to administration of any intervention by the clinician. While the use of placebo can lend validity to a well-designated clinical trial, it poses ethical dilemmas when effective treatments for the disease under study. Penicillin for staphylococcal pharyngitis. Many researchers advocate that trials to be designed to compare experimental drug against against the current standard care rather than placebo. The ethical dilemma of unambiguous situations such as this one presented in this case, where an effective standard treatment regimen exists, where the administration of placebo could cause harm. In such scenario, the use of placebo would be unethical and should be strictly avoided.
You read B and C.
I don't understand this.
Oh,
What they are
um,
trying to mean.
they're trying to say that they should just compare cephalosporin with penicillin. We know penicillin is what we use for strep pharyngitis, and they want to do the new drug, which is cephalosporin. They should just compare the two. Because what if the kid really has strep pharyngitis? Now you give him the placebo, and the pharyngitis, you know, it's the placebo,
Yes.
so it's not really a drug. And then the pharyngitis just advanced to rheumatic fever or whatever, whatever, because you just gave him a placebo, you know. So yeah, you get your results that the cephalosporin is working better than the placebo, but now the kid is sick and you let him get even more sick, because you just gave him a placebo. Whereas you could have given him penicillin, and at the other kid you gave them cephalosporin. So even the kid that just got the penicillin will still be fine because he's still getting some kind of medicine, you know. Does it make sense?
Yes.
No. Yeah. So they're saying that if there is already a standard treatment like penicillin that we know, and you came up with a new drug like cephalosporin that you want to try, just try penicillin versus cephalosporin. You don't need to add a placebo there. Because if the disease is really bad, then you are not treating it, you're giving a placebo that's not a medicine, and the person can die.
Okay.
That's kind of
Yes,
what
that
it's saying.
makes
Yeah. Can you read B and C?
sense. B and C.
Yeah, B as in boy and C.
User finders fee to recruit sub user finders fee to recruit subjects is incorrect. Finders are often viewed as unethical because of their propensity to create conflict of interest and are illegal under anti-kickback statutes uh, under anti-kickback statutes in 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 particular jurisdictions. However, the use of placebo in this study represents a greater concern because of potential harm to the study participants who are randomized to the placebo, and use of minor or as subject is incorrect. The while patients are considered a vulnerable population because of their inability to give informed consent. Some conditions, treatment should be may, some conditions or treatment may be studied in pediatric population where the disease under the study is more prevalent, such as example of strep pharyngitis. Okay.
Okay. 27 woman comes to the physician for follow-up exam. She has a 5-month history of temperatures 101 and a cough productive of phlegm and mucus. 5 months. She has severe asthma treated with high dose prednisone. She has had numerous visits to the ED since childhood because of uncontrolled symptoms. Respiratory wheezes are her bilateral labs. Hemoglobin is, I guess that's normal. Leukocyte normal. Segmented neutrophils, I want to say high. Let me double check. Hemoglobin is normal. Neutrophils is fine. Um, where am I? Eosinophils is high. Lymphocyte is low. I guess
And
fine.
serum Ig is very high.
Serum Ig is very high. An X-ray of the chest shows patchy bilateral um, upper lobe infiltrates that have shifted in locations since the X-ray was taken 4 months ago. Okay, CT scan of the chest shows central bronchiectasis without lymphadenopathy. This patient is most likely to have an immediate response to which of the following on skin testing.
Okay. Okay, it is ABPA, allergic bronchopulmonary aspergillosis, a hypersensitivity reaction caused by presence of Aspergillus fumigatus organism in the airways. The clinical syndrome is associated with transitionary infiltrate peripheral eosinophilia bronchiectasis. Patient typically present with constitutional symptoms including generalized fatigue and mild fever and progressive cough and asthma-like symptoms that persist despite treatment. Brown and black sputum and hemoptysis may be noted. Lab studies are notable for eosinophilia and increased serum IgE concentration. Skin testing for a response to Aspergillus antigens and Aspergillus specific antibody serum assay can aid in diagnosis. CT scan of the chest is the gold standard for diagnosing and characterized by central bronchitis and signs of mucoid infection. Treatment involves treatment consists of systemic corticosteroid, antifungal drug, anti-IgE medications. Okay,
Hmm. Can you
and
read?
yes,
I've never heard about all these ones. D, E, and F.
okay. DEF,
Uh-huh.
Cladosporium. Cladosporium species are the most common black mold organisms that grow in the moist indoor environment, and inhalation of the spore can cause hypersensitivity symptoms and including asthma, allergic rhinitis, hypersensitivity, pneumonitis. And this patient's presentation is more consistent with allergic bronchopulmonary aspergillosis. Isocyanates are organic compounds are widely used in manufacturing and implicated in causing occupational asthma. Symptoms are worse when the patient is at workplace and improve when they are at home. And thermophilic actinomycetes are ubiquitous soil and plant matter organism associated with hypersensitive pneumonitis in associated with hypersensitivity pneumonitis where pneumonitis in farmers, cattle workers, farmers, lung patients develop chronic bronchitis and asthma symptoms. Okay.
Hmm. Next. 4-year-old boy undergoes splenectomy to control bleeding from injuries sustained in a motor vehicle collision. His postoperative course is uncomplicated, and he received pneumococcal and meningococcal vaccinations in preparation for discharge at home. After discharge, which of the following is the most appropriate follow-up intervention to decrease this patient risk for subsequent infections?
Okay, asplenia can occur because of congenital anomalies and splenectomy after trauma or because of chronic vaso-occlusion and infarction in condition with sickle cell disease. Vaso-occlusion and infarction in condition with sickle cell disease. The spleen removes opsonized pathogens and infected by mechanical infiltration in the sinusoid caused by phagocytes and splenic macrophages. Additionally, the spleen houses immunoglobulin producing B lymphocyte. The spleen plays an important role for infection with encapsulated bacteria and antibiotic prophylaxis. Antibiotic prophylaxis mm,
Thank
Okay,
you.
sorry.
Mm-hmm.
Thus, patients lacking of spleen are at risk of encapsulated bacteria, and antibiotic prophylaxis against this organism is often indicated. Okay, typically penicillin or amoxicillin.
Amoxicillin. 22 newly gravid are women with cystic
Okay,
fibrosis.
can you see my screen
Let me see. Not yet. Now.
now?
Mm-hmm.
Now, can you make me understand? We have done these questions, but I forgot how to go with this question.
Oh, Jesus. This biostat. Okay.
I'm very scared about this. Okay, I'm
Okay.
reading the question. You
Uh-huh.
explain. Okay, okay,
Okay.
okay. Objective. To investigate the relationship between exercise and the use of glucose lowering medication treatment in patients with type 2 diabetes mellitus. Hypothesis: exercise is related to the use of glucose lowering medication in the treatment of patients with type 2 diabetes mellitus. Methods: designed randomized control and exercise based lifestyle intervention. Follow up period is 12 months. Participant: 920 participants, 53% male, and mean age is 54, with non-insulin dependent type 2 diabetes mellitus. Intervention: exercise intervention in 610 or standard care in 310. Participants in this exercise intervention group were stratified by turtles based on the accumulated volumes of the exercise completed during the 12-month intervention. Lower turtle T1 120 to 240 per minute of week. Intermittent turtle is 241 to 360 minutes per week, and upper turtle T3 is more than 360 minutes per. Outcome measure: discontinuation and reduction of treatment with glucose lowering medication at 12 months. Reduction of mean difference for change in the HbA1c level from baseline to 12-month follow-up. Results. Results is the exercise intervention. Uh, the exercise intervention was associated with the exercise intervention was associated with discontinuation p-value. P is 0.003 and reduction is 0.007, and the treatment with glucose lowering medication with overall HbA1c equal to 0.003 on 12-month follow-up, and however association were not always across the volumes of exercise. Okay,
Mm-hmm.
you explain this
Of what? Which one?
like.
Oh, the answer. Okay. You want to read that question?
Okay,
The
this one.
Mm-hmm, mm-hmm,
A
mm-hmm.
49-year-old man comes to the office for a follow-up appointment. The patient has a type 2 diabetes mellitus that was diagnosed 6 months ago. He takes metformin twice daily, but she says that it makes him weak and causes abdominal pain and diarrhea. Patient does not engage in regular activity but says he is willing to start an exercise regimen if it will help him with his diabetes. Based on this study, which of the following is the best response to this patient?
Okay. So he is in the probably first step that because he doesn't exercise at all.
Yes,
And then I forgot the relative risk has to be included in the confidence interval. I think if I remember.
yes,
right? Okay.
Yes.
So all of these include the relative rate in the
Re-
confidence interval,
yes.
right? The
Yes.
old.
All.
And then the confidence interval should not include, what was that? Was it 1 or 0? Should not include, forgot. Was it 1 or 0?
Confidence interval should not include. I think that one.
I think 1. Okay. If it's 1, then reduction in blah 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 of that would not be statistically significant, I guess. Um. Okay. And then the answer choices: an exercise regimen of more than 360 is the only way to increase his likelihood of discontinuing. So this one, uh, glucose medication at the end of the whatever. But this is not true because we can see that T3, yes, it includes the relative risk in the confidence interval. The confidence interval does not include 1, so that's good. But T2 also does the same. It includes the confidence. You get what I'm saying? It includes the 25 inside the confidence interval. And the confidence interval doesn't include 1, so it's fine. And then the T1 is the same thing. It's also good. So A is not right because all of them will cause to discontinue the the medication. You get what I'm saying?
No, last word I do not understand.
Okay,
The
so we're trying to find
mm,
the confidence interval. How can I explain that? The answer is telling us that only the T3
yes.
will work to lower to discontinue the medication. Only the T3. That's what the answer A is telling us. Okay. But
Okay.
we can see from the table that T2 and T1 also are right, that they also make us discontinue the medication,
Okay.
right?
Yes.
Because because T3, the 38 is included on from 31 to 40. You can find 38, so it's included. And
Yes.
the confidence interval is doesn't include 1, so it's a good confidence interval, right?
Yes. Yes.
T, T2 is the same thing. 25 is included from 15 to 26, and it doesn't include 1, so it's good too. And T1 also, 12 is included from 1 to 14, and it doesn't include 1. So it's also, so all of them will cause you to discontinue the medication. So all of them are good. So A is not the right answer. Okay, then B. I think B, you got it right. You know why it's not the right answer. Um, yeah. So was A the only thing that you were not sure about? Because you answered the question right.
No, I answered the question right, but
Yeah.
there
So
are
we
some flaws. Like if you explain all the options, then it
all
would
the
be
options.
yes.
Okay. Okay, so B, physical activity with a volume of exercise similar to the current recommendation of 150, whatever, is needed to generate significant improvement in A1C. Okay, so the 150, was it the T1, T2, or T3?
T1.
T1. Okay, so they're saying that only T1 will show improvement in A1C. That's what option B is saying. Okay, let's do T1. We have negative zero point 0.3, which is included in the confidence, so it's good. And the confidence interval does not include 1, so it's good. So okay, yes, that applies to the answer. Now let's look at T2. It includes negative zero point 0.7. Yeah, it's included in the confidence interval, and the confidence interval does not include 1,
One.
so it's good. Yeah, that
Yes.
one is also good. So that means B is not right because T2 also it's is will work. And now
Yes.
T3, negative zero point 0.7, is it included in the confidence interval? Yes, but look at that confidence interval. Wait, does it include 1? No, it doesn't include 1,
No,
so it's
nothing.
also good. So that one, so all of them will cause a change in A1C, not just T1. So that's what B is wrong.
Okay.
Okay, then we go to C. The patient will be significantly more likely to reduce his glucose. Now we're looking at the middle one, the middle row. The patient will be more likely to reduce his glucose lowering medication treatment if he's able to exercise 150, so T1 for an entire year. Okay, let's look at T1. 3.7 is included in the confidence interval. Yes.
Yes,
Does
and
it
it yes
does it
it does.
include one?
No.
Yeah, 3.7 is included in 0.3 to 9.4. Yes.
Yes,
Now the
yes,
uh-huh. Now the confidence interval includes one. So that's not a good confidence interval. That's not good. So this is not statistically significant. It's not good.
yes, because
But
it
you
includes one.
yeah, but you said the answer choice is telling you that this is good. So that's why this answer choice is wrong.
Okay.
Yeah. And then the last answer, the last E. Oh wait, no, that doesn't even make sense. And then D is there is significant chance that he can lower his A1C and reduce or discontinue lowering medication treatment if he exercise more than 240 per. What was 240? T1, T2 or T3?
T2.
T2. Yeah, so they're saying that basically look at T2, discontinuation, reduction, A1C, all of that should be statistically significant. Now, if we look at T2, discontinuation, 25 is included between 15 and 26, and it doesn't include one, so that's good. Now we do go reduction in T2, 4.8 is included between 2.5 and 12, and it doesn't include one, so that's good. Now we look at A1C, negative zero point 0.7 is included between negative zero point 0.1 and that doesn't include one, so that's true. So that's why the D is true. Does it make sense?
Yes.
Okay. Okay.
Okay, then last,
Oh,
the second
there
part
is
of this
which
question.
one? What? There is a you didn't tell me there was a second part. Okay.
Yes,
Mm,
this is two part, I think so.
okay. Can you read the question? What is
Okay,
the question?
everything is all
The
same.
same.
Yes.
Uh-huh.
Based on the study, which of the following is the best response?
To this patient.
Okay,
And in
okay, and if we rule out the first, an exercise regimen more than 360 per minute, like this one, T3,
mm-hmm,
is
mm-hmm,
the only way to increase the likelihood of discontinuing this row.
mm-hmm,
Discontinuing glucose lowering treatment at the end of 12 months. So an
mm-hmm.
exercise regimen more than 360 per minute is the only way to increase the likelihood of glucose lowering medication treatment at the end of 12 months. Is
So
not
that
the only way.
exactly you
Okay,
got it. It's
the
not
what?
just.
Okay,
Mm-hmm,
so that's why not only. Okay,
mm-hmm,
and the next one, physical activity with a volume of exercise similar to current recommendation, 150 minute per week, like this one, 150
uh-huh,
minute per week is
mm-hmm,
needed to generate significant improvement in HbA1c level.
mm-hmm.
Physical activity or volume of exercise is similar to current recommendation, 150 minute is needed to significant improvement in HbA1c level. So,
Mm-hmm.
so why it is not the answer?
That one is a good answer. Yes, it showed improvement, A1C, but look at T2. T2
T2
also showed
also shows improvement,
even
and
more
T
improvement.
yes,
Yeah, because it's zero point 0.7. It's even more improvement, and T3 also show more
more
improvement.
improvement. Okay,
Yeah. Mm-hmm.
so that's why it is not. Okay, the this this patient will be significantly more likely to reduce the glucose lowering medication if he is able to exercise 150 minute per week for an entire year. Significantly more likely to reduce glucose.
So which row are you looking at?
This row
Yes. And which
and this
column?
one.
Yes.
So it is not statistically significant because it includes one,
Exactly.
so it rules out. So there is a significant chance that he can lower HbA1c and reduce or discontinue lowering medication treatment if he exercise more than 240 and HbA1c. So there is a significant, so this is right because it caused significant change more above
Mhm.
everyone, like it similar to T3 but more than T1. So this is the answer, that's why.
Yeah, but here you're not looking just at A1C, you're looking at all of them. You see, it says reduce, discontinue, A1C. You're looking at all the
Okay.
discontinue, reduce. Yeah, you're looking at all of it. Yeah. Mm-hmm.
Okay. And the last one, there is currently no statistical evidence to suggest that the to suggest that the patient will able to improve his diabetes but if he starts an exercise regimen now.
Yeah, you know that is wrong. I mean, we found some that are statistically significant. We
Okay,
found a lot that are statistically significant.
okay, okay, I got it.
Okay.
Okay, thank you.
We are